Okay, today, you guys, we're going to talk about the liver. If your liver could testify in church today, it would probably say, Saints, pray for me. I've been through it. Between Sunday dinner fried chicken, sweet tea, and that occasional celebration drink, your liver is doing deliverance ministry 24/7. But seriously, our bodies are the temple of the Holy Spirit, and that includes our liver. It's time we honor God, not just with prayer, but with our plates, our habits, and our health. Let's learn how to keep this vital organ strong, clean, and functioning so it can keep doing what God designed for it to do. Now that I've got your attention, let's dive into what liver disease really is, what causes it, and how to prevent it, and how a few smart choices can help your liver stay strong for years to come. Liver disease means something is damaging or stopping your liver from working the way that it should. Your liver is one of the largest organs in your body. It works like a filter and a factory all in one. It removes toxins, helps digest food, it stores energy, and makes important proteins for your body. When it's damaged, these jobs can't get done properly, and waste can build up in your body. Now, there are several things that can cause liver problems, including infections such as hepatitis A, B, or C. These are from viruses. These are viral infections that directly attack the liver and cause inflammation. We'll take a deeper dive into each one of these conditions in another video, so stay tuned for that discussion. Next, alcohol use. Drinking too much for too long damages liver cells. Now, let's be honest, this one is common and often underestimated. And when I say alcohol, I'm not just talking about the obvious drinks. Even certain mouthwashes or just a little wine every night can quietly strain your liver over time. So moderation, or better yet, complete avoidance, is one of the best gifts you can give your liver. Next, fat buildup in the liver, called fatty liver disease. This is often linked to obesity, diabetes, or a poor diet. Think of it like this. When the liver gets crowded with too much fat, it struggles to do its normal cleaning and filtering properly. And then we have toxins or medication. And this is a sneaky one. Even over-the-counter pain medications, herbal products, or supplements can be harmful if used too often or in high doses. So it's important to read labels carefully and check with your healthcare provider before taking new products, especially if you already have liver concerns. Next, genetic disorders. Some people are born with conditions that make the liver hold on to too much iron or copper. For example, Wilson's disease. These aren't caused by lifestyle, but they do remind us of how important regular checkups and blood tests are, because sometimes liver issues are hidden in our DNA. And finally, there are autoimmune liver diseases, where the body's own immune system accidentally attacks the liver as if it were your enemy. This is another reminder of how complex our bodies are and how vital it is to catch these problems early through regular lab work and open communication with your healthcare team. So as you can see, liver disease can come from a lot of different sources. Some we can control, and others we just need to manage wisely. The good news is most cases can be prevented or slowed down through healthy habits and early care. So let's talk about how to do that next. Number one, limit alcohol or avoid it altogether. Alcohol is one of the biggest causes of liver damage. The liver has to work extra hard to filter it out of your blood. And over time, This can lead to scarring, which is called cirrhosis, or liver failure. Even social drinking can add up over time. Be mindful. This also includes mouthwash, as I said earlier, cough syrup, and cooking wines that contain alcohol. If you struggled with alcohol, remember every day you choose to stop is one step toward healing. Next, eat for a healthy liver. Food is medicine, and what you eat can either heal or harm you. Choose fresh fruits, vegetables, lean proteins, whole grains, and healthy fats like olive oil and avocado. Avoid greasy foods and heavily processed foods that overload the liver. Add liver-friendly foods like garlic, leafy greens, berries, and green tea, all rich in antioxidants that help the liver repair itself. Think of your plate as a reflection of respect for your body and for the one who made it. Next, maintain a healthy weight. Being overweight can lead to a fatty liver disease, even if you do not drink alcohol. It builds up excess fats in your liver cells, making it hard for the liver to function properly. Start small, walk daily, cut sugary drinks, and portion your meals. Every pound lost in the right direction is a step toward healing. Next, keep moving. Again, exercising regularly. Your liver loves movement. Aim for 30 minutes of moderate activity most days, at least 3 to 5 a week. Walking, dancing, biking, and even consistent housework. Exercise helps burn fat, lower cholesterol, and boost blood flow, all of which protect your liver. You don't have to run marathons. Just move the body God gave you with consistency and care. Avoid risky behaviors. Hepatitis viruses, especially B and C, can spread through blood contact. Never share needles, razors, nail clippers, or toothbrushes. Use proper protection and caution with tattoos, piercings, or medical procedures. Protection isn't just physical, it's wisdom in action. Next, get vaccinated. If you haven't already, ask your doctor about vaccines such as hepatitis A and hepatitis B vaccines. These vaccines protect against 2 major causes of liver infections. Unfortunately, there's no vaccine for hepatitis C, but awareness and early testing saves lives. Last but not least, use medications safely. Never mix alcohol with medications, even pain relievers such as Tylenol. It can harm the liver when combined with alcohol. Don't exceed the recommended dose of the over-the-counter herbal supplements. And always check with your healthcare provider before starting any new medications, even the medications over the counter. Remember, natural doesn't mean safe. It doesn't always mean safe. Again, I say, natural does not always mean safe. Your liver still has to filter everything you swallow. Let's be honest. Hearing the words liver disease can sound scary, but here's the truth. Not all liver diseases mean the same thing, and not all of them are permanent. Some types of liver disease can be completely cured or reversed, especially when they are caught early. For example, hepatitis C can now be cured with modern antiviral medications. Fatty liver disease often improve when you lose weight, eat healthier, and stay active. However, other conditions like cirrhosis can't be fully reversed because the liver tissue has already turned to scar tissue. Still, treatment can slow the damage, prevent new scarring, and give the liver time to function as best as possible. In more severe cases, when the liver becomes too damaged to recover, a liver transplant may be needed. But even then, Doctors and patients work together to keep that new liver strong and healthy for many years to come. The most important thing to remember, the liver has a remarkable ability to heal itself when given the right care. The sooner you take action, the greater your chance of recovery is. Now let's talk about real life, because knowing what to do and actually doing it are two different things. That's where a health coach can make a huge difference. Living with or trying to prevent liver disease can feel overwhelming at first. There's new information, lifestyle changes, and sometimes medications to keep up with. A health coach walks you through it all step by step. A health coach can help you create a simple meal plan that supports some liver healing. We can keep you accountable to your goals, whether that's cutting back on alcohol, exercising more, or staying hydrated. We can teach you how to read labels and pick better foods at the grocery store. We can also help you set realistic weekly goals, like swapping soda for water or walking 10 extra minutes a day. We can help you track your progress, celebrate your wins, and remind you of why. Because consistency brings healing. We partner with your doctor, bridging the gap between medical advice and daily living habits, turning what feels hard into habits that heal. Psalms 147:3 says, He heals the brokenhearted and binds up their wounds. That includes our physical wounds too, even those we cannot see, like a tired or damaged liver. So if you've been putting off a checkup today, start today. If you struggle with alcohol or poor habits, start today. And if you've been waiting for the perfect time to change, today is that time. Remember, your liver may work silently, but it carries the weight of every choice that you have made. Treat it like the precious gift that it is. I love to hear from you. What's one change you're ready to make to love your liver this week? Leave it in the comments. Or what other health topic would you like me to talk about next? Drop your thoughts and questions in the comments below. Your feedback helps shape future discussions, and your story might be the one that inspires someone else's healing. Until the next video.